My name is Nidhi Saxena and run a company by the name of Zoctr Health, which is a home care company and which is using modern medicine and long-term care to support chronic conditions such as cancer, neuropsychiatric ailments, COPD, asthma, post-operative care, etc. So while we have had some very powerful stories about the holistic side of healthcare, let me get into the hardcore data and numbers. And again, my talk here would be basically, the healthcare challenges that we're facing and how healthcare can really uplift women, especially in the Indian context. So a hypothesis that I have is that because women are economically disadvantaged, the access to healthcare is also limited. And that is validated by the statistic in India, wherein almost 48% of our population is women. There is almost 6.5 billion women. Yet, the per capita or the GDP contribution of women is just 17%, which also translates into the healthcare spend on women being about 20% of the total healthcare spend in India. Now, what are the big challenges? These are humongous challenges that we're talking about. Let us start with female foeticide, which is very pertinent in the Indian context again. So about 500,000, which is 500,000 girl children are lost every year due to female foeticide because we prefer to have boys as children, right? The second part is maternal deaths. So in every 100,000 pregnancies that happen in India, 450 women die each year. And that is a higher number than, let's say, all the developed countries in the world, much higher number. The third part is malnutrition. So in our clinical practice, when we talk about rural healthcare programs, we realize that 75% of women have anemia or other kinds of deficiencies, which could be vitamin D, which could be B complex, etc. So malnutrition, and there are about 25,000 deaths a year due to malnutrition alone. And this is also because, the diet and nutrition of women, there's a differentiation and a bias when it comes to diet and nutrition for women vis-a-vis men in the country. Then let's look at the chronic and the long-term ailments. So breast cancer is about to become a big epidemic globally, and 20% of all breast cancer cases are going to come from India. Then there is cervical cancer. There is also the big HIV epidemic. So we are saying that almost 40% of all HIV cases are with women because simply they do not have access to contraceptives. They are not aware, their sexual education and awareness is poor. So those are the kind of challenges we're facing, not to mention the neuropsychiatric health issues. So we are dealing with several old and single women who are living alone with Alzheimer's or Parkinson's, and Zoctr, which is my company, which is providing nurses, attendants and doctors, and also some bit of holistic support and integrated medicine support. So palliative care is an example when you talk about cancer, pain management as an area, etc. And so this is the lifeline for some of these women. So again, it seems like the light at the end of the tunnel seems to have been switched off. But then we have a ray of hope. Because many things have changed in the Indian context in the last 10 or 20 years. Now let us look at the provider side. We've looked at the patient side. What is the provider equation? So out of all the doctors we have in India, 17% are women. The balance 2/3 are men. In rural population, where women population is almost 50%, there are only 6% doctors who are available who are women. So it's a very poor ratio of 0.5 doctors, allopathic doctors, per 10,000 women. So how can healthcare really uplift and transform women is the question or the problem I'm grappling with, and some of you are grappling with here. And I believe there are two solutions to it, or two ways in which this equation can change. The first part is in terms of providing employment, direct employment, and caregiver support. So if you look at the workforce, women workforce in India, we have 130 million women, which is 10% of the total population of 1.3 billion, who are gainfully employed. Out of this, only 1.3 million, which is 1% or less, are employed in the healthcare sector. Whereas healthcare is one of the most underserved sectors in this country, and we need about 50 million healthcare professionals in the next 5 years to really be able to support the kind of patient base we are having. Hence, what we believe is that we could have 50 million professionals who could be women and who could be working in healthcare as a sector, and that is a huge employment industry for women in this country. The second part is the problems I just spoke about. There are so many public programs, There are so many public-private partnerships and NGO programs which address issues such as female foeticide or anemia or rural healthcare as an example. So now what my company Zoctr, which is a startup which is just 14 months old, and we are very close to a Series A round of 10 million. So in that sense, we are a very young company. But 70% of our current workforce is women. These are doctors, these are nurses, these are attendants, these are dietitians, psycho-counselors, physiotherapists. So it's a big women-constituted workforce. That is, I think, one of the contributions. The second part is that having realized that women have special healthcare needs, we have come up with some very interesting programs which focus on, let's say, pregnancy and mother and child care post-pregnancy or postpartum. So here we want women to get back to their jobs very quickly. So we provide services wherein we support the mother and the child, lactation, breastfeeding, losing weight, all of that, and get them to shape quickly. And then the third part is that these are all solutions to the urban population. Now, can we really contribute to the rural milieu, because that is where the big problem is? So we are evangelizing what you call telehealth and telemedicine, wherein we've created Zoctr.com and we have a video consulting module there. So what happens is that we use point of care diagnostic technologies when somebody locally will take their CBCs or take their blood samples and other tests. All that data gets uploaded onto my system online, and then doctors sitting in Bombay and Delhi would be actually able to talk to those patients and provide prescriptions and provide a solution to their healthcare problems at a very low cost of maybe under $5 per patient. And after we've provided the prescription and solutions, we work with the public healthcare system, the PHCs, in all these villages to make sure that the medicines that those women need, or the nutritional support that those women need, the supplements that those women need, are delivered either through the government channels and also through some partnerships with pharma companies and insurance companies. So I would like to end my talk on a very simple note that ultimately it is women who can really uplift women. So my team of women, and interesting enough, I have 3 men who work for me here, is trying our best. Thank you so much, ladies and gentlemen.
Hello. Thank you all the panelists for sharing your valuable thoughts. We have still 10 minutes of time, so if any questions needs to be raised from the audience, they can have a question for the panelists.
That cost, because I know that in India the private healthcare is privatized. And so is there a market that would support that type of employment growth?
Yes, it is, because see, a lot of the nurses, as an example, the healthcare professionals, see, we are all realizing that doctors are in short supply. And you cannot meet the medical needs of a population by just having doctors. You need to have a whole coterie of healthcare professionals. And traditionally, if you see, the ratio of women nurses or attendants or support staff, dietitians, counselors is somehow skewed in favor of women. So if that number really starts growing, and our issue and the bottleneck is really around training institutes. We have limited training institutes, and every year, you're talking about 10-20,000 professionals coming out when it should be 1 lakh, 2 lakh professionals. So I think the industry would definitely support, and there is a need, but it's about how do you build capacity.
Okay, you raised a very valid point. We are short of professionals. Are we really short of professionals? You are constrained the supply. Typically, I understand about 3 or 4 lakh hopefuls want to be doctors. Right? I've done some rough analysis, purely ad hoc.
Yeah.
At least half those 3 lakh people, that means 1.5 people lakh, can be made into potential good doctors.
Right.
We have artificially created this shortage. This shortage has been created so that people can make a lot of money in capitation fees and in the misery of the people. Now, why don't we look at it as a problem? If we don't look at it as a problem, and we say there's a shortage, I mean, for 70 years we've been independent, we still have a shortage. Either we people are blind, or we are mad, or we are...
No, so statistically, I'll give you an answer, and I completely agree with your point that there is an artificial shortage or, the capitation issue. So I agree, it's a valid point. But when you look at the population growth and the chronic diseases, you're talking about 150 million geriatrics, and add to that all the other comorbidities such as cancer, neuropsychiatric, all of that. So the ratio today of qualified doctors to number of patients, in that sense I'm saying shortage, 0.9 per 1,000 patients. which is the lowest, one of the lowest across all countries in the world. So what we are saying is we need to have higher number of doctors, and we need to have a way and a mechanism to kind of bridge the gap between the demand, which is very huge given that we have such a large population.